Anxiety disorders are characterized by feelings of intense fear and anxiety and associated behavioral disturbances. The symptoms are very severe and lead to significant distress or significant functional impairment. There are several types of anxiety disorders, such as generalized anxiety disorder, characterized by excessive feelings of anxiety; panic disorder, characterized by panic attacks; social anxiety disorder, characterized by excessive fear and anxiety in social interactions; separation anxiety disorder, characterized by excessive fear or anxiety due to separation from people with whom there is a strong emotional bond, and several others. Depression is different from normal mood swings or short-term emotional reactions to difficult situations in everyday life. A depressive episode is characterized by a worsening of mood, expressed as sadness, irritability, feeling empty, or loss of interest in any activity for most of the day, almost every day, for at least 2 consecutive weeks. A number of other symptoms may be present, including decreased concentration, abnormal feelings of guilt or low self-esteem, lack of faith in the future, thoughts of death or suicide, sleep disturbances, changes in appetite or body weight, and feelings of extreme fatigue or decline. People with depression are at high risk for suicide. People with bipolar disorder are characterized by alternating depressive and manic symptoms. During a depressive episode, there is a worsening of mood, which is expressed as sadness, irritability, or feeling empty, or loss of interest in any activity for most of the day, almost every day. During a manic episode, elevated mood or irritability, a rush of energy and excessive desire for activity may be noted, as well as some other symptoms such as increased talkativeness, jumping ideas, increased self-esteem, decreased need for sleep, distractibility, and impulsive rash actions. Individuals suffering from bipolar disorder are at high risk for suicide. The prevalence of PTSD and other mental disorders is particularly high in countries affected by armed conflict. PTSD can result from a person being placed in a situation of extreme danger or an extremely traumatic event or series of events. PTSD is characterized by 1. Re-experiencing the traumatic event or events, intrusive memories, flashbacks, or nightmares; 2. Avoidance of thoughts and memories of the event, or avoidance of activities, situations, or people that remind one of the events; and 3. A constant sense of heightened threat. These symptoms persist for at least several weeks and result in significant functional impairment. The life expectancy of people with schizophrenia is lower than average by 10-20 years. Schizophrenia is characterized by significant disturbances in perception of reality and behavioral changes. Symptoms may include persistent delusions, hallucinations, disorganized thinking, significant disorganization of behavior, or extreme agitation. People with schizophrenia often also experience persistent cognitive impairment. Eating disorders, such as anorexia nervosa and bulimia nervosa, are characterized by abnormalities in eating and preoccupation with food, as well as marked anxiety about weight and appearance. These symptoms or behaviors pose a risk of serious health harm, result in significant distress or significant functional impairment. Anorexia nervosa often begins in adolescence or early adulthood and is associated with premature death due to medical complications or suicide. People with bulimia nervosa have a significant risk of substance abuse, suicidal ideation, and health problems. This type of disorder, also known as conductive disorders, refers to one of 2 subtypes of antisocial behavior and dissocial disorders, along with defiant deviant disorder. Antisocial behavior and dissocial disorders are characterized by persistent behavioral abnormalities, such as persistent provocative or hostile behavior that is systematically accompanied by violations of the basic rights of others, or basic societal norms, rules, or laws in effect for a given age group. Antisocial and dissocial disorders usually begin to develop in childhood, although there may be exceptions. Central nervous system developmental disorders include behavioral and cognitive disorders that occur during development and are accompanied by significant difficulties in acquiring and implementing specific thinking, motor, speech, or social skills. This group of disorders includes, among others, intellectual disabilities, autism spectrum disorders, and attention deficit hyperactivity disorder, ADHD. ADHD is characterized by persistent difficulties in concentration and/or hyperactivity, impulsivity, that have a direct negative impact on academic or vocational performance or social functioning. Intellectual disabilities are characterized by significant limitations in cognitive function and adaptive behavior, as reflected by difficulties in learning and implementing conceptual, social, and practical skills in daily life. Autism spectrum disorders, ASD, are a multidimensional group of conditions characterized by varying degrees of difficulty in social communication and social interaction, as well as a range of restricted, repetitive, and inflexible patterns of behavior, interests, or activities.